This training video will teach you how to treatment plan and create a surgical guide for up to 3 implant cases for patients that do not have extensive metal restorations, using the CT skin of the patient and an optical model skin of the relevant jaw to create an STL file. For patients who have pre-existing extensive restorations, please see the animation for pre-existing extensive restoration. Blue Sky Plan is an advanced full-featured treatment planning software for computer-guided surgery and can be downloaded from blueskyplan.com. The relevant files for the case that will be presented in this training video can be downloaded from blueskyplan.com/step-by-step and can be used as a practice case in the Blue Sky Plan software. To take advantage of the powerful treatment planning software, the minimum recommended requirements are 16 GB of RAM on the computer, 2 GB of RAM on the video card, and an Intel i7 processor or comparable. After downloading and installing the software, complete the registration form and press Submit form. Within a few seconds of pressing the Submit button, the notification will appear confirming that the software has been registered successfully. Confirm the default settings for surgical guide module in normal mode and then press the OK button. Press the Start Wizard button. From the drop-down lists, select the option to import a model STL and the Blue Sky Bio fully guided surgical kit and then press the OK button. Navigate to the desktop using the shortcut button on the top of the screen and select the file patient CT for model STL wizard.zip. Press the OK button. Grab and drag the yellow border lines to reduce the field of view and define the area of interest. Reducing the field of view better utilizes your computer's resources and enlarges the relevant anatomy in the software views. Press the OK button. For a maxilla case, press the maxilla button on the top of the screen. For a mandible cases, use the slider under the 3D view to raise the density threshold and remove scatter if needed. Left-click once on the exit of the right mental foramen to have the nerve detected. If you need to redo the step and draw the nerve again, click on Detect Right Mental Foramen to remove the drawn nerve. The nerve can also be detected by holding the slider with your left mouse button and moving your mouse to move through the slices and locate the slice that shows the exit of the nerve. The exit of the nerve can be left-clicked to be detected. Press the Next button. Left-click once on the exit of the left mental nerve to have the left nerve drawn automatically. Press the Next button. Navigate to the location of the scanned model by pressing the desktop button. Select the file STL model lower.stl and then press the OK button. Hold down the Shift key and left-click to every other tooth in the model scan. To rotate the model, release the Shift key and grab and drag with the left mouse button. To continue marking the teeth, once again hold down the Shift key and left-click to continue marking the teeth. Mark every other tooth in the CT scan view as well by holding down the Shift key and left-clicking on the relevant teeth. Press the Next button. Use the left mouse button to grab and move the slider next to the bottom left view, the cross-section view, to move through the slices and confirm the model outline that is visible in the slices is wrapped tightly around the existing teeth. Use the left mouse button to grab and move the slider next to the axial view, the second box from the left, to confirm that the model outline is wrapped tightly around the existing teeth, especially as you move the slide upwards and approach the occlusion. Here are some examples of an accurate and an inaccurate alignment. The image on the top left shows the model outline too far from the exiting tooth. The image on the bottom left shows the model outline overlapping the existing teeth. The images on the right side show the model outline wrapped tightly around the existing teeth but is not too far from the existing teeth or overlapping the existing teeth. If the alignment needs to be improved, press the previous button. Mark additional teeth. Then once again press the next button to confirm model alignment. Press the next button after model alignment has been confirmed. Left-click to select the correct virtual tooth in the location of the missing tooth. Select small, medium or large to represent the size of the desired virtual tooth. Press the implant button to select the desired implant to be placed together with the virtual tooth. Select the relevant jaw, the desired implant system, and the relevant implant. We are going to be selecting a Blue Sky Biomax 4.3 by 10 mm implant. Press the OK button. Press the OK button. Left-click once in the bottom right view to place the missing tooth in the relevant location. The view can be enlarged by holding down the right mouse button and moving your mouse forward. Holding down the wheel of the mouse as if it was a button and moving your mouse in any direction will allow you to grab and drag the view. The 3D view can be rotated by using the left mouse button to grab and rotate the view. In the bottom left view, the cross-section view, use the left mouse button to grab and drag the implant to move the implant. Use the left mouse button to grab and rotate the circle surrounding the implant to tilt the implant. Moving or rotating the implant to the left will move or tilt the implant buccally. Moving or rotating the implant to the right will move or tilt the implant lingually. In the tangential view, the view second to the right, moving or tilting the implant to the left will move or tilt the implant mesially. Moving or tilting the implant to the right will move or tilt the implant distally. Once the implant and virtual tooth are in the correct location at the correct angle, press the next button. Now, use the left mouse button and rotation widget to fine-tune just the implant placement without affecting the placement of the virtual tooth. Press the next button. The brown software guide tube represents the exact location and size of the hole that will exist in the printed surgical guide. Hold down the Shift key and click and hold the left mouse button to start defining the area for surgical guide fabrication. While holding the Shift key and the left mouse button, move your mouse along the model to draw a curve and define the area of the surgical guide. Release the Shift key and use the left mouse button to rotate the model as needed and press the Shift key again and left drag to resume drawing the curve. Draw the entire curve and close the loop by returning to the original start position and press the next button. Using the left mouse button, grab and drag any of the nodes that appear along the surgical guide curve to fine-tune the curve positioning and to straighten any crossed segments. Press the next button. The surgical guide is created and appears on screen. The hole in the surgical guide perfectly aligns with the software guide tube and the implant vertical axis passes through the center of the software guide tube. Press the next button. In order to save the file of the surgical guide to your computer for 3D printing, you are required to buy export credits. If you do not have export credits, the software will prompt you automatically and payment can be made via PayPal or credit card directly in the software and the software will update automatically. Case fees are between $11 and $20 per case depending on quantity of exports ordered. After purchasing export credits, the software will update immediately and automatically. The drilling report provides case images and valuable case information such as drilling depth, drilling sequence, and a list of implants, drills, and metal cylinder parts to be used in the case. In order to create a new folder where the treatment plan, surgical guide, and drilling report will be saved, click the New Folder button on the top of the screen to create a new folder. Enter a folder name and click once to select the new folder. Press the OK button. The software will ask you if you would like to complete the approval form. If you will be sending the treatment plan or surgical guide for surgical guide fabrication, press the Yes button. Complete the approval form. Press apply and save. Use biobigbox.com, Blue Sky Bio's HIPAA-compliant file transfer system, directly from within Blue Sky Plan, to send the treatment plan or the surgical guide to a dental lab or any recipient. If you do not yet have a BioBigBox account, create one free at biobigbox.com by entering your email and creating a password. Enter the email address and password from BioBigBox into the relevant fields. Select laboratory in one of the labs in the pre-populated list to send the case to one of the certified labs, or select email and enter the relevant email address to send the case to anyone with email address. Select the option to either send the exported surgical guide file or the option to send the entire Blue Sky Plan treatment plan file. Include any relevant information in the message box and then press send. Press the next button. The Blue Sky Bio website will open with the relevant metal cylinder and other relevant Blue Sky Bio parts added to the shopping cart. If you already own the relevant part, or would like to remove a part from the shopping cart, press the red X to remove any parts from the shopping cart. Log in or register if need be and complete the checkout process. Return to the Blue Sky Plan software and choose from the on-screen options to start a new case or to close the wizard.